We're here today to announce that Indiana has, in fact, received its first case of coronavirus COVID-19.
This individual is currently in isolation, and there is no ongoing risk to the public.
The most important thing you can do is very frequent hand washing and minimize touching your face.
Guys, we don't even want you shaking hands. We don't want you hugging anybody. And we do want you to know how to learn the Indy bump when you're greeting other people.
Yes, this is what Dr. Virginia Kane is talking about. The governor did it before this morning's news conference. When greeting people, use your elbow instead of a handshake or a hug. We continue to follow the breaking news that Indiana has its first case of the coronavirus. The patient is a male from Marion County.
So the good news is that he contacted the state health department, who directed him to Community North Hospital. The governor has declared a public health emergency. Now, ITMate's Stephanie Zeppelin tells us why that's an important first step.
Jenny Drasler on what we need to do now that the virus has arrived in the Hoosier State. And Travis Robinson talks with people attending or planning to attend big events this weekend on what the precautions are that they're taking.
But we start our team coverage this evening with News 8's David Williams, who has more on the first confirmed case. David.
Well, late this morning, Indiana's Governor Eric Holcomb, along with the state health commissioners, stood before reporters and declared the coronavirus is here. Health officials said he is not currently in the hospital, but he is in isolation away from others. Health officials said he will be in isolation for at least 14 days. Now, this morning, doctors said he will stay in isolation and will not be released until 2 weeks. Period, and that negative test has happened. Dr. Virginia Kane, the director of the Marion County Health Department, told us the positive test came back this morning. The patient had just returned from Boston, where he was working closely with a conference. Today, Governor Eric Holcomb declared a public health emergency for Indiana.
Today just serves as yet another reminder of the importance to stay informed and prepared as you carry on with your daily lives.
Health officials say the patient and hospital did everything possible to limit the virus exposure. Doctors told us no patients and no other caregivers were exposed to the patient. Dr. Bach says officials are investigating whether the patient exposed any of his family members to the coronavirus. And Dr. Kane tells me the Centers for Disease Control will be investigating the passenger manifest on that flight. They also say the CDC will be identifying and notifying people who were on that flight from Boston to Indianapolis who may have had close contact with that patient. For now, we are live in downtown Indianapolis. I'm David Williams, Wish TV, News 8.
David, thank you very much. I want to get right now to News 8's Jenny Drasler.
So Jenny tells us what we need to do now that the virus has arrived in the Hoosier State. Jenny, to you.
Yeah, Brooke and Phil, I sat down actually just moments ago, separate outside of that news conference that David was at. I spoke to those health officials one-on-one. They said that this patient, he did exactly what he was supposed to do. His reaction was what they called textbook. They said that he did not panic. He called first, and that's when health officials told him to come here to the emergency room parking lot of Community North. Now, they said that the man's decision to call health officials first, warning them where he would be at and exactly what parking lot. They said that, guys, this was pivotal in reducing the number of people that he actually came in contact with. I spoke to Dr. Robin Ledyard with Community Health, and she says that her team did not take the patient through the emergency room, and they commend him for not walking in by himself. They say that this is the type of reaction that could potentially save lives. Now, as far as what you guys need to do, it's a big question here tonight. If you think you could be showing symptoms of coronavirus, health officials say the biggest thing that you should do is do what this man did, call ahead first, and do not walk into a crowded hospital or healthcare facility.
If you have a fever of at least 100.4, you have a cough or you feel short of breath, and you feel as if you may have been in an environment where another person had COVID-19, then you should first call your doctor's office, call the hospital, call the health department, and get instructions on what you should do next. You will not be abandoned. We will reach out to you and provide you the care that you need and the appropriate testing.
Now, Dr. Ledyard tells me that they got back those positive results around 9 o'clock this morning, so about 10 hours later, and that's why she urges anyone, because of that, just the sheer time frame that it takes to get those test results back, that if you think you do have symptoms, you need to practice self-quarantine. Live from Community Health North, Jenny Dreisler, Wish TV News 8.
All right, Jenny, thank you. Our team coverage continues now with Travis Robinson.
Yeah, big events in the city this month. And Travis, you talked with people attending or planning to attend, right?
Yeah, there's thousands of people who are coming downtown this week for the Big Ten tournaments. But the people that I spoke to said one little case of the coronavirus isn't going to stop them from enjoying games. Many people downtown today just finding out that they're in coronavirus territory.
No, I didn't hear about that. I didn't know that they hadn't had one yet today in Indiana.
Some showed me that they've been expecting this news as they whipped out Purell bottles. A couple of people were worried about the virus.
I was wondering why they came back here.
But the overwhelming majority of people I spoke with said even with the virus in Indianapolis, they're not concerned.
Not a real concern. I think if you're careful and, do what makes sense.
I think people are well aware of it, and they're all afraid of it. So I think everybody's trying to follow the rules.
Some going as far to say the entire outbreak is just a marketing ploy.
I think it's just to get people buying some products and put a little fear in us, but I think we'll be fine.
Those attending the Big Ten tournaments filled with thousands of people from around the country say it's good to be careful, but the virus should not dominate your life.
Go on doing your everyday things. If it happens to you, it happens to you, but you can't just stay home and do nothing all day and because of this fear. It's not as bad as I think they make it seem.
There's so many people that die from the flu in general that I don't think, I think it's a little overboard.
And most of the people I talked to who weren't even concerned about the virus still said that they were going to be washing their hands and just keeping track of the virus as it spreads. I'm Travis Robinson, Wish TV News 8.
Travis, thank you very much. Well, now that the coronavirus is here in Marion County, the state is looking forward to getting some financial help from the feds.
And they talked specifically today about some of the things they would use that money for. My teammate Stephanie Zeppelin has those details.
Yeah, even though there's only one diagnosed case of coronavirus in Indiana, they have tested a dozen people and are monitoring dozens more, and officials hope to get their hands on some money to help with that. Today, the president signed an $8.3 billion funding package to help fight coronavirus. The money will boost funding for testing and help cover the cost of treatments. Vice President Mike Pence said that money will be available for state and local response. The state health commissioner says there are a lot of needs here. They'd like the money to help pay for more epidemiologists to investigate the spread of the disease. So things like talking to everyone that patient may have talked to and finding out where they went and who else they might have infected. They also need to buy masks for people in isolation, pay for additional testing and treatment, and pay to keep people in isolation. Dr. Box also said they need more resources for their call center, which is being flooded with calls from medical professionals and concerned Hoosiers. No word yet on when the state might be able to get a piece of that federal money. Stephanie Zeppelin, ITeam8.
All right, Stephanie, thank you very much. We're going to bring in our medical reporter, Dr. Mary Gillis, now with a closer look at this, a little bit more perspective for us tonight. What should people know about this case?
So this case, as we know, it was our first case in Indiana. This person is from Marion County. This person contacted the disease or contracted the disease from human-to-human contact. This person was in Boston. They found out that this person they contracted the virus from had been overseas. This person came back. They did exactly what they were supposed to do. They called the hospital before they just ran into the emergency room, saving not only, healthcare workers that could have been infected, until the hospital was able to find a plan and triage this person into an isolated area.
Okay, so I want to go back to this press conference that was held today with the governor and health officials at the State House. What were some of the main takeaways for those of us who couldn't attend and haven't been able to tune in?
The message was, it's okay. It's coming. Yes, it's here, but we couldn't be in better hands. I mean, I took a big sigh of relief after watching that press conference. I mean, this state, Marion County, and our government officials are on top of this, and they have been for a really long time. Hospitals across the state are talking to one another about a systematic way in which we are handling the virus, and I thought it was just such encouragement that we're we're going to be okay. We're going to be in really good. We're in really good hands.
Reassurance.
And
Yes,
we're going to talk to Dr. Virginia King coming up here momentarily. But what can we do at home to make sure that we stay safe?
So reiterating the things that we do really to help us ward off any sort of sickness or disease. Hygiene, hygiene, hygiene. That's number one. So what we want to do is make certain that we cough in our arm, right, in our elbow crease when we sneeze or when we cough. We want to discard any tissue. We don't want those laying around on a surface. We want to make sure that we Clorox things that surfaces that we're exposed to, such as phones or laptops and stuff like that. We also want to make certain that we have wash our hands, please. 20 seconds. You will not regret it. And then having that antibacterial, 60% alcohol that we want to have antibacterial on hand.
Okay. Dr. Mary Gillis, thanks so much for those tips.
Thank you.
We're going to get an update now on some numbers. The number of confirmed coronavirus cases worldwide has now pushed past 100,000. So cities around the world taking precautions. San Francisco has launched a new coronavirus text alert system. Miami, Florida has postponed 2 major international music festivals.
We're emphasizing the public that this decision is not a cause for alarm or panic, but rather that we are doing it in an abundance of caution.
Outside the U.S., meeting of EU ambassadors in Brussels was canceled when a second European Council staffer tested positive for the virus. And in northern Italy, Catholic masses have been suspended in the hardest hit regions.